On Talk Time this great Saturday morning, we are dealing and, of course, trying to still reflect a bit on our healthcare. But this time around, we're looking at traditional medicine as a complementary approach to conventional healthcare. It's been quite a while we sunk our teeth into traditional medicine and what it can do, or perhaps what it cannot do. But this morning, we're focusing on that, and I'm bringing in a specialist who's going to be talking to us in that regard. Dr. Leye Popoola is traditional medicine consultant, and of course, he's also the founder of Nature Healing Alternatives, and he's joining me right here in the studios. Dr. Popoola, good morning.
Good morning, Victor, and good morning, Nigerians.
Wonderful. It's been quite a while. We had you on the program about 3 or 4 years ago, right?
That's right.
So where have you been?
Well, work is at a continuum, and we are rolling in and rolling out medication every day.
Right.
So we go for training, we train people, and we go into the bush in Nigeria to look for herbs to present and to use for the healing of the people.
Which is very, very good. So that means you'll be moving gradually to the permanent site.
That's it.
All right. So you are a traditional medicine consultant of several years standing. How many years have you been in this?
About 25 years
25
now.
And
Yes.
counting.
Yes.
So how is that aspect of our healthcare in Nigeria going? How's it faring?
That's good. We are moving forward. Every day we are moving forward. Young people are coming in. Graduates are coming in, joining us. And you know, the young people these days, they are faster and they want to know everything. And they can actually know everything with the help of the AI, with the intervention of internet. I think things are looking good and looking bright.
So they're looking brighter for the traditional medicine sector in Nigeria?
Yes.
Oh, okay, that's good. Well, we have lots of Gen Zs these days, so it means the population of Gen Zs in the world today is very, very high. So they might not really know what we're talking about. So what is traditional medicine? Maybe you just want to expand that scope for them.
Okay, traditional medicine is looking after healthcare through the use of herbs, animal parts, and natural remedy,
Okay.
natural ingredients.
Okay, so the use of, we call it herbs, right?
Yes,
And
herbs,
animal parts.
and other natural ingredients.
Right, so how different is it from conventional medicine?
Quite different in the sense that the conventional medicine, let's look at the doctor, for example. The doctor is only to consult, recommend medication. The medications, they are made by pharmacists, and the pharmacists, they have their own board, and the orthodox medicine can decide to do operation. The traditional medicine healer doesn't do that.
Okay, that's a major difference.
Yes.
So traditional medicine cannot do surgery.
He also is the consultant and is the provider of the medication that's going to be used in most cases.
Okay.
That's the case. That's it. So he must be his research must be at a continuum.
All right.
And if he wants to excel in his trade or in his choice of trade, then he has to be on ground and keep moving and keep learning. Doctors may not need to do that. If you provided, you just make your recommendation, and if there are new things coming in, the pharmacist will let you know, and then you give recommendation.
Okay, so for traditional medicine, you are not a medical doctor, are you?
No.
All right, so where do you get the titles from?
You get trained. There are so many schools that can train you in Lagos now, and
you can you can get degrees from it.
Yes, and then you know that before you can become a practitioner in Lagos State, you have to go through the attestation of the Board of Traditional Medicine, in Lagos State.
Okay, so Dr. Popoola, I'm very, very curious right now. Traditional medicine has been around for centuries.
Yes.
And from your observation, is it still popular amongst our people, or is it declining?
I think it's getting more popular because, let me just cite a simple example. One of the fast-moving commodities in Nigeria today is Gari. Gari sells like no other product, and nobody is advertising it. Traditional medicine has been with us from the beginning of our existence. If you look at the Bible, you see what happened in the Garden of Eden, and you find out that Adam and Eve, they were living on the vegetables that were available in the garden, and using natural things like that is in itself can be defined as traditional medicine. So everybody is involved in traditional medicine.
In one form or the other.
When you came into consciousness, your mother will cook soup, put onions, put pepper. They never knew the reasons why they were putting all those things, but it was good for all of us. But looking back now, the pepper enhances blood circulation. The onions helps to thin the blood. So actually, there is nobody, provided that you wake up any day and you eat, you have taken traditional medicine.
Okay.
Because our food is actually our medicine. Yes.
So you can say for sure that all we're doing in this world has one form of traditional medicine or the other.
That is correct.
Okay. All right. So from your perspective, it's not on a decline?
No.
It's not?
It is because the young... Okay, you know, there is a Yoruba proverb that says that any tradition that you don't involve the youth, that tradition will fade away. The young people are coming in now to introduce and to, bring about modernization in traditional medicine. For example, you see young people, they are fast, very fast, and doing great things, unlike the older people who are calmer, who are slow. They take things to higher levels. I think in a few moments from now, maybe a few years to come, you see traditional medicine having gigantic offices all over the country, and maybe doing exploit just like their partners in China and so on, because they can see all these things on the internet.
In terms of practice, how many practitioners do we have that are registered as traditional medicine practitioners in Nigeria?
I may not know, but we are quite many. We'll be over 1 million.
Over 1 million practitioners?
Yes,
wow.
Will be over 1 million.
Okay. So we know that the health sector has been hit by a whole lot of jackpot syndrome in Nigeria. Doctors are migrating out of Nigeria. Is it the same thing for traditional medicine practitioners?
No, some move to South Africa that I'm aware of. Some, but very few. It's not like that. The traditional medicine trade is a profitable trade, and if you have knowledge, you need to acquire knowledge in order for you to be able to excel in your trade, in your choice. I mean, in your trade. So if you have knowledge, you may not need to go to anywhere, because this is the place,
So considering the fact that we have a depth of doctors around, can Nigeria's health sector look up to traditional medicine practitioners as a remedy? Can we begin to say, well, despite the fact that we are losing trained hands to the jackpot syndrome, maybe we can just look for succor with traditional medicine practitioners? Should that be the case?
I don't think so. Do you know why?
Why?
The two are not the same. I also want to let you know, the Nigerian public listening to me, you must listen to me with very open heart and very positive attitude.
Right.
You have gold in traditional medicine, but people are not embracing it because they are looking at traditional medicine as the worship of Ogun or worship of Ifa. It is not a religion. It is a process through which ease is brought into the life of the people through the use of herbs. And many people think by using herbs, there must be incantation. There are many herbal practitioners today who are good Christians, who are great Christians, who are born-again Christians, who do not even know anything about Ifa, and who do not practice anything in that regard. If we take that off, then you also want to see that the colonizer, they came to Nigeria or they came to Africa to tell us that our religion is not good or was not good, and that maybe many things from us cannot be is substandard. In fact, they wanted to put to us that we are substandard to them. But I think Nigerians are not taking that as a way of life. But we must be able to reclaim our own glory. We must be able to look inward and see what the traditional medicine had done over a long period of time. And then we must come to a conclusion that we need to embrace them, we need to encourage them, and that is why the Lagos State government and other state governments are copying Lagos State now. Lagos State has had a board of traditional medicine since the year 1979. Okay. And till date, it's developing it and using it positively as a centrifugal, as a centripetal force, okay, to bring us to unity and then to foster the interest of the people in general.
Let's begin to break this down for our listeners this morning. So, what are the things that traditional medicine can do, and what are the things that it cannot do?
Well, I also want to let you know this morning that there is no disease that does not have medication, except if you have not seen it.
You mean it?
Yes.
Low blood pressure?
Low blood pressure, anybody who suffers from that, take it from me now, just go and look for mistletoe.
Mistletoe?
Yes, mistletoe leaves.
That will solve it?
Drink as tea morning and evening.
You mean it?
If you do that continuously, that's the end of that problem.
Mistletoe leaves?
Yes.
Wow.
And then you must look. One of the reasons, anytime there is any problem, you must be able to investigate, why do I have this? Because some people, when they are worried, they have low blood pressure.
Right.
So you want to examine your life. How far have I been able to go when I get worried? You get worried over things that will never come to light at all. A lot of people get worried over their grandchildren that we do exploit in life. You get worried over something that will happen next year. Maybe you get worried over the fact that there could be COVID again. They will never come. Many things human beings are worried about, 90% of them, they don't come to fruition.
So let's talk about those ailments now. So you said for low blood pressure, it can be treated, right?
Yes.
Cancer?
Cancer too can be treated. Depending on, for example, if somebody who has breast cancer and maybe one of the breasts had been chopped off, that it may become difficult for a traditional healer to handle that immediately.
Because it has gone
too bad. Right. Maybe if that person goes to the hospital and they get it, they know what to do to get it done. They remove it, and then the person can come back and take traditional medicine, and then it will flush out from the system entirely. Because the one that has wound that has gone that bad may have other problems that we create. For example, let's say somebody who has stroke, for example. If any of my patients has stroke, what we tell you, just go to the hospital, go and get treated. When you are stabilized, come back. Then we'll give you the medication, then you are well.
You mean it?
Yes, because there may be, someone who has stroke, for example.
In that case, traditional medicine is not independent.
No, That is not to say so. For example, when that person comes back from the hospital, do you know that they go back again? They can have another stroke.
Okay.
Yes, because I'm not here to run down anybody, but what you will be giving is just medication to bring down your blood pressure if there was a blood pressure related problem.
So it's just treatable. It cannot be curable.
Yes. So if you come, the stroke will be investigated. Why did you have stroke? And then you will be advised on what to do, what to eat, and what not to do, and then you will be given medication.
Can traditional medicine survive on its own without serving as a complement to conventional medicine?
It can, but you know, when we are talking of traditional medicine, you know, you may be looking at, for example, laboratory tests. We might need laboratory tests. You can be saying, okay, that's conventional medicine. But without those in the past, we had done so well. So our great grandfathers, they didn't know all those things, but they had plans they gave treatment that were effective to people at that time.
Let's talk about diagnosis now, because one of the challenges that people have always had with traditional medicine is how to diagnose a patient. So I'm having stomach pain, or perhaps a combination of headache, stomach pain, and sometimes rapid heartbeat, and all of that. How will a traditional medicine know what's wrong with me?
Okay, let's digress a little bit. When you talk to a mechanic on the phone, my car is at Ojodu, it has broken down. He will tell you, when you put the key, is it cranking? You say yes. How does it crank? He will say, okay, go and check the battery head. You put the battery head and it goes. So part of the training is that we must be able to understand that when you have these symptoms, many of our patients, we don't see them physically any longer. You just talk to people. Maybe outside Nigeria, you talk to.
So you do traditional medicine care?
Yes, yes, that's it. And once you know, you can say, okay, go and do this test, and get back to me immediately. Once, for example, somebody's blood pressure is 180/90. Yeah, I mean, there is nothing about that. Nothing. You know what?
That's high.
Yes, that's very high, and you know what you should be expecting.
Right.
There should be headache. There could be stroke, and for you to prevent that, we have to go into action.
Right.
So it's not the traditional medicine had been there, and it had done so well. And it's still doing good. I
mean, that's what I'm saying. How would you diagnose that? Okay, for instance, somebody gets, let's say, a venereal disease. I mean, somebody has a sexually transmitted infection, which sometimes might not manifest until maybe some time later, or perhaps. So, how will traditional medicine heal and know that this is sexually transmitted?
Okay. Let me say this to you. Today is not 40 years ago. Today we have technology. For example, there are some machines that have magnetic ray connected to the computer. You can use it to diagnose people. And if you are not very sure, you can now go and do this test. For example, what you have just mentioned now. There will be some symptoms that will come up when you have such venereal diseases that is still not manifesting. Maybe your body is hot, you are having malaria every time, and then you can do full blood count, which will show the level of your white blood cell that is fighting something. This is fighting something which we don't know.
Right.
And then you must now start to investigate that thing. But let me say to you, in traditional medicine, for people who have infection, maybe in orthodox medicine, you must be specific about the infection, and then there will be medication recommended that will be sensitive to that infection. In traditional medicine, there is nothing like that. What we do is that we have medication for general infection, and it will clear it.
You mean it?
General infection. And if it is viral, we have medication for it. We proved that during COVID. I think you know that.
Right.
And so, don't let me say more than that.
Lagos Traffic Radio, 96.1 FM. Dr. Leye Popoola is our guest this morning on Talk Time. He's a traditional medicine consultant of several years, over 25 years standing. And of course, this morning, we're looking at traditional medicine as a complementary approach to conventional health care. Let's get back to the roads. Within the Ojo corridor, earlier on, we told you of a broken down battery-loaded trailer that broke down around the Ojo end. But what I can tell you, the truck has been successfully recovered and will be finally off the road in a short while. Sufficient access has now been granted to vehicles to ease the backlog, while we still have on ground the traffic managers trying to sort out things. So take note of that. That's within the Ojo end this morning. All right, then most of the other areas are still looking good. If you head into the island, you can still make use of Eco Bridge as a connecting point. Is looking good. The Third Milan Bridge too is also looking good. And of course, we can also tell you that if you're navigating through Lagos Abeokuta Expressway, is also looking good as well. From the Mile 2 end, movement from Second Rainbow connecting Mile 2 OK down to Outer Wharf in and out is still very much in good shape. And movement from Mile 2 underneath the bridge down to Dorba Junction as well as Maza is very, very good at the moment. Likewise, for the return journey, Maza down to Total Filling Station, slightly busy between that station on the main carriageway up to Car Watch, but very, very good. If you're heading to Suru Alaba, Alakija environs is still very, very in good shape as well, both in and out. And then we can tell you, Abule Adu, as well as Festac and Navy Town is also looking good as well. We'll be serving you more helpings as they come in from time to time. You can also join the conversation this morning. We're talking on, we're looking at traditional medicine. And if you have a point or you have something you want to say to the doctor in the studios, who is a traditional medicine consultant, feel free to connect with us. And that's on 091 5387 7127. 091 5387 7127. These are the numbers that you can connect with us. All right. You did say that traditional medicine can treat any disease, right?
That's very correct.
And you guys have been doing that successfully.
People get to know. Don't call a dog a bad name. They know it. They don't want to accept, but we know, and people who are gotten maybe healing through traditional medicine, they know.
Well, some people say that what they have is not really healing. Maybe they get relief, and somehow the thing seems to relapse again when they get treated by traditional medicine. Okay,
when you get treated for malaria, you get ill for that period. When you go and get infected again, maybe mosquito bites you again, then you have malaria again. If you have infection and you are treated for syphilis and you go back to your vomit, you are going to get it again. So it's not a matter. For example, if you have cancer and you have been treated and you are good, the traditional healer is going to give you some guidelines on what to do and what not to do, what to eat and what not to eat. If you go back to those things, you are going to have them again. So you must not, in traditional medicine, you must be able to take your medication. You must also be able to listen and abide by instructions. Then you will have good health perpetually.
Is it every herb that is useful for medication?
That's where we all miss it. Not every herb is good for human consumption. Or let me put it in another way.
All right.
It's not every herb that is suitable for each individual.
Okay.
Okay. Let's say somebody who has somebody who has low blood sugar,
All right.
cannot take cinnamon.
You cannot take cinnamon.
You cannot. And you cannot take mistletoe, because all these, they will lower your blood sugar. And this is one of the reasons why we tell people, don't do self-medication. Don't think that because these things are available around you, then you can just go and plug them and start using them anyhow.
What is mistletoe in Yoruba?
Mistletoe is afomonishano.
Ah.
And if you have low blood sugar, if your blood sugar is usually about 60, 68 or 69, 66, 67,
All right.
you cannot take moringa leaves, you cannot take moringa tea at all. So
If your blood sugar is low.
if your blood sugar is low. So these all herbs are not suitable for everybody. There are some that will be suitable for you, some that may not be suitable for you.
All right. A message here says, "Good morning, Dr. Popoola. What's one thing you wish every Nigerian knew about natural healing?" Chris is sending that morning from Ikeja. Chris, thank you so much.
Okay. Chris, this is what I would have loved every Nigerian to get to know. This traditional medicine is for all of us. We all practice it. Get to understand that you need to get more knowledge about traditional medicine. You cannot, there is nobody who is here. If people disabuse you or try to convince you to the contrary, just get to know that this is for you and this is suitable for all of us.
Let me see if I can take this call. Hello there, good morning. Hello. All right, 08099120777, 09153877127. Hello there.
Hello, good morning.
Yeah, good morning. What's your name?
My name is Alex. I'm coming from Logba.
All right, Alex, how are you doing?
I'm doing fine. Please, I want to ask the doctor, is there any drug for low sugar? Any drug for it?
Okay, Victor, let me address this low sugar thing once and for all. When you are having low blood sugar, you are likely not eating well.
Is that the reason?
That may be one of the reasons. Then you must look at your liver function. Liver stores the sugar, it stores glucose for you. Then you must also be able to check whether your pancreas is working well. And all the food that we have told diabetic patients not to eat, that's your own meal. And just exactly what I just said now.
Okay.
So you must be able to eat eba. You must be able to eat fufu, eat amala, and eat pounded yam, and so on. In many cases, people who have low blood sugar, they are on soft drinks all the time. They take soft drinks. Soft drinks will only put sugar in your system for a short while. After a while, then you will be lacking in sugar. Please, people who have low blood sugar, understand it this morning. Don't tell us that you are, I don't want to be eating, you must eat proper meal.
Okay, so there's a difference now. There's low blood sugar, there's low blood pressure.
Low blood sugar, low blood pressure.
Right. So for low blood sugar, you said they're supposed to eat lots of sugar.
You must eat complex carbohydrates. Yes.
But for low blood pressure,
yes.
How can traditional medicine deal with that?
I said it. Simple something, not no story. Get mistletoe leaves.
Say it in your right.
Drink.
Ewe what? What do you call it?
Ewe afomonishano.
Afomonishano.
Yes. Just drink it.
Is it common?
Very common.
Drink. One can find it around?
You can find it in the market.
Okay. All right. Yes, go ahead.
If you can't find it, you can
reach out.
You can reach out to me.
09153877127. You have any questions for our guest this morning, who's a traditional medicine consultant? You can feel free to join the conversation. I'm learning a lot, and I can tell you there's so much that one can learn. Now, the leaf known as ewuro is one that lots of people seem to consume. They say anytime you have any blood, maybe low blood or anything, or your blood is not sufficient, people always want to talk about the ewuro leaf and all that. Is that correct?
Bitter leaf is a very good thing. It's a very, very good, wonderful herb, but also misused by many people. For example, someone who has low blood sugar cannot take it. That's another thing. And it may not give you iron, so it may not be good. It may not give you blood. It may not give you blood like that.
Right.
If you are deficient in iron. So don't go into that direction. But bitter leaf is a very, very potent herb for things like high blood sugar and maybe stomach trouble, and so on.
Can traditional medicine deal with complex health conditions like heart
problem?
Yes.
Okay. Why do we have heart problem?
Tell me.
Number one, you find out that people who have heart problem, something must be wrong with their arteries. The arteries of the body is supposed to also be very flexible. If your heart is not flexible, it means that you have been taking some things that are not compatible with the good health of the heart, of the arteries. Like if you are a smoker, if you take some oil, you take fried things and so on. There are herbs that will help you, that will help your blood, your arteries to be okay, to become more flexible. There are herbs for the heart. We have autumn berries and autumn leaves, which is meant for the heart. Dancing is there that will help the heart to function at its optimum.
Properly.
Yeah, so but there are some congenital problems that may require surgery,
which traditional medicine cannot deal with.
Traditional medicine doesn't do
All right.
surgery.
More reactions coming in for you. 09153877127. This one says, good morning, Victor. Thank you for this subject. I am curious, do you think younger people still show interest in becoming traditional medicine practitioners, or is it mostly for the older generation profession? Nuruddin is sending that one in. Let me see if we can take this call.
Hello?
Okay.
Hello there, good morning.
Yeah, good morning.
All right, what's your name?
My name is B. I'm calling from Ogba.
Regular B, how are you doing?
I'm very good. Happy weekend.
Happy weekend to you. Go ahead.
Yeah, I'm just talking about this topic. Traditional medicines are okay, but the problem I have with them is that any Tom, Dick, and Harry can just
Pick it
tomorrow
up.
that is curing this, is curing that. I think more needs to be done about the regulation. So how do we get them regulated so that not anybody can just wake up tomorrow morning? They're all over WhatsApp, online. Somebody just wakes up tomorrow morning. They have cure for this. They have this, So what can be done to regulate them?
All right. Thank you so much for that, B. So do you guys also have NAFDAC registration, for instance?
If you want to put anything on air or you want to sell anything on the shelf, you have to have your NAFDAC registration and approval. But let me answer B, because Lagos State gives you a certificate, and that certificate is conspicuously displayed in every traditional medicine clinic. So any clinic where you go and you can't find the Lagos State license, is not a suitable place for you to take treatment.
All right.
So that's the regulation, and that's it.
Let's talk about measurement now, because one of the arguments against traditional medicine is that there's no very concrete measurement. So how can one deal with that? I mean, when you take Agbo, for instance, now, They just tell you to keep taking it. You can take it as many times as you wish. So, how does that come to play?
Okay, Victor, this is another one. We still want to call a dog a very bad name.
Is it a
in most places now, when you go out there and you give medication to people, you even make sure so that it will go. If it is agbo, it has to go with a cup. That this is the cup you are going to use, and this is the spoon with which you are going to take this tea or this powder.
All right.
You know, so every day we are learning more, and we found out that sometimes the efficacy of our medication is if used
Appropriately.
as prescribed.
Okay.
And many people could not get to understand what is called half cup.
Okay.
So you have gone out to make a cup and to give the patient cup for each medication.
So things are changing.
So very fast.
All right. Nuruddin's question was about, is it older generation that are making use of this, or do you have younger ones coming in? Okay, let's take this call. Hello there.
Hello,
Yeah, good morning.
Victor.
Hey, Ambassador Musbao, how are you doing?
I'm fine. Long time.
A long time.
Yeah. Good morning, doctor.
Good morning.
I think great. We are really enjoying it. Now, doctor, I want to ask you this question. When how can someone have high sugar level affect the libido? Let me get it clear. You also have high blood sugar. I think this can affect the libido, and that person is trying to use some drug to enhance his performance. What's the danger in it?
Okay.
Okay.
Am I clear?
Yes.
Very clear, very clear.
Yeah, that is one. Secondly, traditional medicine, how do we separate this? We have a lot of traditional medicine. We call it herbalists. How can we separate it from those who are going to spiritual? Because, that's what is care. Sure, I mean, when you go for herbs, completely fine. But when you go do your conjunction, this, say one this to this, that's what means care using herbs.
Okay.
Am I clear? So how do we separate them?
All right.
And what are you doing to separate these people from those who are talking at war? And is there any mention you are trying to put on them to checkmate them?
Thank you very much.
Thank you.
Okay, then. So the difference between the spiritualist and a traditional medicine practitioner, any major difference?
Very major difference is that a traditional medicine healer deals with herbs, animal parts, and other natural things to ensure that healing takes place.
He doesn't partake in incantations.
That's not his line of the other people. Their religion is their line of trade.
Okay.
So somebody who is an Ifa oracle consultant now, he may be looking after people traditionally too, but that's not his major line of call. His line of call is spiritual. Then the other one, let me say to everybody here today that when you are diabetic, there is a problem. Diabetes is not one disease. Don't get it wrong. It's a whole bunch of diseases put together in a container and put on somebody's head. That's the way it is.
Okay.
Part of it is that your blood will start not to circulate as ought to be. And what gives erection is blood circulation. If your blood is not circulating properly, if somebody has given you medication that will just bring down your blood sugar, that person is doing incomplete job.
Okay.
Part of it should be to look into the complications of diabetes and then give you medication for that again. So as you are taking your medication to bring down your blood sugar, you must be looking at bringing down, because if you have too much sugar in your brain can malfunction.
All right.
If you have too much sugar in your eyes, you are not going to see well. If you have too much sugar, your heart can malfunction too. So it is important to let you know that you will not have good libido if you are diabetic.
So what can he do?
What you can do
Quickly.
is that you can actually see a good consultant.
Okay, and then they will let
and
you
then
know.
they will let you.
All right, this one says, good morning and happy weekend. I feel we Nigerians are drifting away from the traditional healing that has served our fathers well for centuries, and we are too reliant on prescription drugs. What can be done to reverse this trend? You didn't put your name, but thank you so much. This one says, can traditional medicine actually cure cancers or slow down their growth and progression? Bola Tito is sending that one in from Bagada. All right, so even as we round off, there are lots of questions that are coming in for you. But
Okay.
how can we really appreciate the good work of traditional medicine? I mean, you heard Musba there talking about those that, are spiritualists and all of that. So how can we differentiate you guys? And I mean, what are you guys also doing to ensure that the real practitioners that can really deal with these diseases are the ones that people can consult?
Well, the Lagos State Board of Traditional Medicine, I think they have done that. We are there. The separation is there already. People who we are consultants on our field. We do not know anything. I'm a good Christian. I go to church. Other people that you are talking about, they don't go to church because they are traditionalists.
Right.
So the difference between the two is obvious immediately you come across us.
All right. So, and the last question I want to ask you, why is that most of your prescriptions are always bitter? Can't you have prescriptions that are sweet a bit? I mean, they have just to sweeten the mouth and all of that.
Okay. Somebody asked one question. Let me... the young people, they are coming in now.
Okay.
And many of our medications too, they are going into capsule. They are being capsulated
right now.
So the improvement will continue as we...
So not all of them will be bitter, right?
Yes.
Okay. Let's round this up. For those who would like to connect with you after this time out, how can they reach you?
You can reach me on 080-330-69864. On
that's 080-330
080-330-69864.
All right, we'll leave it at that for now. It's nice having you in the studios. Dr. Leye, Popoola, thank you so much for being here.
So nice.
All right, I'm waiting to the day when you guys will come and tell me traditional medicine has healed this person of cancer, or perhaps has healed this person of HIV, and then we can move to the next level. Thank you so much for being here.
Thank you.
Okay then, so the program this morning has been produced by Dayo Anthony. I say a big thank you to Remy Aluko, and of course, maximum shout out to Okpayemi Shodunke as well. Our executive producer is Tayo Akonle. My name is Victor Oteri. I'm out still very much within. I'll be back by 10:15 for Maritime Today.